Hi, my name is Marie Pampanin, and I am your host of Yoga Therapy, the Alchemy of Healing. If you enjoy the subject matter or know somebody that might, please pass on our links as well as hitting the like and or subscribe button. Maybe even show us a little bit of extra love into the
Hello
podcast.
again.
Thank you so much.
Thank
Hi.
you so much for joining me for part two. I'm
Thank
so
you for
excited to
having me
have you
back.
here. Thank you. So, just so that, if somebody hasn't seen our first video together, you are a certified yoga therapist, Kimberly Searl, if I say your name right.
It's like
So,
Pearl, but instead of a P, put an S. Thorough.
Searl. You made that so easy, and then I was adding an S to the end. So, thank you. Okay, so welcome back. Today we were going to be talking about everything pelvic floor. So
So I'm curious, when did you first fall in love with the pelvic floor?
when I first fell in love with the pelvic floor and actually just working with the pelvic floor, I want to say it was maybe 15-ish years ago. Um, I had two children. I was jumping around all over the place and, had the typical like, oops, kind of
Mhm.
response to it. And I learned that by breathing and doing some exercises that went away. And so when I would speak to women about, certain incontinence issues, due to children or aging, we'd have these amazing discussions. And what came out of that was learning about breath and how breath is related to the pelvic floor. And
Mhm.
then I, like many other people, I think went, hmm, do men have a pelvic?
Yeah,
Like, of course they have a pelvic floor.
yeah.
That's my next like, and then now I have a definitely a love of the pelvic floor and a positive relationship with the pelvic floor with both men and
Mhm.
women when we're talking about, how to work with breath and to feel a little bit more comfortable in our bodies.
Yeah, yeah, absolutely. Well, I was privileged enough to grow up with a horse. I grew up on a sheep farm, and my dad had a couple horses so we could ride the fence line and things of that nature. And so I fell off, and during my TED talk, I talk about that horseback riding accident.
Mhm.
And I grew up in a very conservative household and upbringing. So, there was no touching there, don't look, danger
Yeah.
zone. Uh, but recovering from my horse accident, I was trying to fit back in with my peers. And
Mm.
I ended up being sexually attacked at a party, at a senior party. And so, between the horseback riding accident and the sexual trauma, I didn't realize that my pelvic floor was disrupted. It was
Mm.
actually a doctor that kind of pointed out to me that I was having some pelvic floor disruption. And then when I started my yoga journey, there was discussion about the pelvic floor because the bandhas, right? Mula bandha
Mhm.
starts with the pelvic floor, and then we move into Uddiyana
Right.
bandha, right? And so I started thinking, like, what is this about? So when I was educating myself for this new career path, I started diving into pelvic floor for a lot of the functional movement courses will talk about pelvic floor. And so then I started hearing about like the coccyx and how the pelvic floor needs to be strong but flexible and it needs to be able to go back and forth. And I thought, that's really interesting. And then there's like 29 muscles that go through there. So how do you know which one? Right? That's so
Yeah.
complex through that structure. And so that's really how my love of the pelvic floor started, which I think probably for a lot of us, we change careers or get drawn to specific body parts just from our own lived
Mhm.
experience with
Absolutely.
that.
Yeah, I
Yeah.
agree with that. Absolutely. Um, when you were having this experience with your doctor telling you that there was a disruption in your pelvic floor, what was some of the thoughts that came through for you?
When the doctor said that, I was in my early
Mhm.
20s at the time. So I was just like, in your 20s, you don't really think you break, or, you're not caring about too much. But if I come, my mid 50s, right, and I look back on my healing journey, I had a lot of tension, like things were stuffed down. That trauma was never talked about. I was shamed about that trauma. And I think all of that tension made for complicated menstrual cycles, a lot of
Mhm.
female health issues. And as I found healing on my own, then I was able to release and let go. And as I healed, I had less and less complications. So for me,
Mhm.
my pelvic floor disruption was trauma based. And as I
Right.
healed the trauma, then my body began to heal, and all of those complications I was having subsided. And I think for me, working as a practitioner now, I think women need to really understand about their body. I'm still finding women who, don't know about all their pieces and parts and how it works. And we're also seeing it play out in our political role, right? We see most political roles are male figures. We're starting to see that shift a little bit, but we know historically it's been that way. And they don't understand that they even, one, have a pelvic floor, let alone how a female pelvic floor
Right.
works. And so then we see them making policy decisions on our behalf, yet they lack anatomical knowledge. And so that's a problem that I have now in my midlife, is like, okay, let's first start with education. And
Mhm.
then let's say that we care for humanity, and we want people to be well. And, let's then move on from there. We both graduated from the same university with our master degrees. And it was during that time that I found Leslie Howard's work on pelvic floor.
Mm.
And I really value her work quite a bit.
It's interesting that you brought up some of the emotions that you had. One of them you said, shame, right? One of the things that I really wanted to kind of unpack a little bit here is that, there's the generational shame. We don't talk about things down below, you know.
Right.
Then there's the you know, spiritual piece of it too, where, some spiritual practices, we don't talk about what's down below, right?
Mm-hmm.
I'm not sure why it's never been, brought up in conversation that men have a pelvic floor, but then there's the whole male, what pelvic floor? That's a female thing. So I think that it's really good to help unpack for people in general, right? That
Right.
everybody has a pelvic floor. We all have a pelvic floor. It's the base of our core.
It is. And, like I had a lot of early on when I was learning about pelvic floor, a lot of my teachers were males. And one of the male presenters had said to me, we have a pelvic floor, we just have one less cutout in it, right?
Yeah,
Because they don't have a vagina, they just have the scrotum, right, that hangs
right.
down. So, I've been, because of the lens of the trauma in my life, um,
Hmm.
I made a study design for chronic pelvic pain. I was really interested in that. And so I was, kind of networking that study design. And in my community, I had a gentleman come up and he said, "Hey, I saw your study design that you were networking about with chronic pelvic pain, but you said it's only for females. What about us males?" And I said, "Well, what
Hmm.
about you? Like most of research has been done on males for females, and like it's the females' time, right?" So I was, well, you know, pushing back a bit on that. And he said, listen, when we have prostate cancer or a pelvic floor disruption, I have to go into an all female center to find the physical therapists that are trained in pelvic floor dysfunction. And I feel uncomfortable, one, with the disease condition, and then two, that I have to go in there. And he said, would you consider working with me on that same study design? I says, well, when I wrote it, I was thinking about females. I think it would work. I'm not 100% sure. You want to give it a go? And we did. And he really did find freedom. He found reduced pain by, educating about the pelvic floor and, doing the therapeutic sequence that I thought might work for that. And so that was really humbling for me. And I joked with him and thanked him for taking me to task on my narrow perspective and view. But yeah, so now, I work with men who have gone through prostate cancer and, want to work on that pelvic floor function. Because we do want it. Like I said, we do want it to be strong and flexible. It has to be able to do both.
And that is definitely something that I will speak into when I'm working, not just with one-on-one clients, but in groups as well. Even in my classes, I'll bring up, that we need to have a flexible, um, pelvic floor. Said much like the diaphragm needs to flow, the pelvic floor needs to flow. And initially, even myself, bringing it into the classes, there was a little bit of, are people going to look at me funny? I'm talking
Oh
about the
yeah,
hernia.
like, do you want to talk about that? When I remember when I was the first teacher, I was like, can we talk about your pelvic floor? Now I'm like, okay, so we're going to talk about the pelvic floor. But yeah, you have to get comfortable with it. Even my teenagers, my youth that I work with, they'll have pelvic floor discussions, male and female questions that come up. And then of course I have to go back to the parent and say, like, is it okay if I talk about this? I know it's a sensitive area. What are your belief systems around it? And so I have to take that, and juggle that in between. But most parents, I would say 9 times out of 10 are like, oh yes, please explain all of it so we don't have to do it. And I'm like, well, wait a minute. But I make it very anatomical so that it's comfortable, right? I don't use any slang language, very anatomical, very matter of fact, so that it can be as comfortable as possible and talking about that religion for people.
And I think that's also good because it brings in that piece of, this is a clinical thing. Everybody has a pelvic floor, right?
Right.
So with the people that you work with, because you said you also work with men, what are some of the symptoms that you hear most, say, in your female population and then in your male population?
Well, I mean, there's a whole host of symptoms. And so I should say there's not one gold standard for diagnosing chronic pelvic pain. It's usually a diagnosis of elimination. And because of that, it can take 3 to 5 years to get diagnosed. So you can imagine as a patient, you get really frustrated. You start to lose hope and confidence. Some people feel like they're not heard or understood or listened to. Once they finally get a diagnosis, it's a whole team of people that you need. And so then that also can be exhausting by, having appointment fatigue, seeing 5 or 6 different people supporting you on this on all levels. And, it's been building, this pain has been building for years. And then, the expectation of, can it be a quick fix? But really it's consistency, it's action, it's teasing apart all the layers. And that's going to take the same amount of time it took you to get into the pickle. It's going to take you that amount of time to get to something reasonable. And so I think that that's difficult too, is to manage that expectation in the mind of what's happening. But, some people have, hip pain, low back pain. Some people have, incontinent issues, right? Sitting sometimes is painful, that pressure pushing down on the pelvic floor. And you had mentioned before, like breathing, right? So, teaching about the 3 diaphragms and that when you inhale, the pelvic floor will bulge a bit. And when you exhale, it'll pick up, right? And that slide comes all along the front of the spine, up underneath the rib cage. And that's really, if we can teach proper Mula Bandha, proper Uddiyana, which I know you have a love of Pilates as well. It's scoop, right? Those are all the same language for the same anatomy, and getting people to understand that container. Because you think about it, like between your pelvis and your rib cage is your organ sac. the largest blood supply, all these organs, and all of that is pushing or sitting down on your pelvic floor. I think of the
Mm-hmm.
pelvic floor like the first floor in your house. So if you don't have good structure there, strength, what's going to happen? It's going to sag and bow, right? We're not going to pass the marble test on the floor because it'll roll right out. So organs, right, will come down. Now, what happens if all that organ pressure is sitting on, for example, for males, the prostate?
Right.
Probably not going to get the best circulation. I mean, I don't diagnose, right? That's completely out of my scope of
Yeah,
practice,
that's not us.
right? So that is not what
We
we
deal with the
do.
symptoms.
We deal with side effects.
Okay.
And so, but I think about that, right? And so
Mm-hmm.
what's the relationship, when I was developing my therapeutic sequences for clients and stuff, I think about what's the relationship to gravity, base of support,
Mm-hmm.
center of gravity, what organs are we trying to affect, so on and so forth. Um, and so, you have to tease all of that out and talk about that. And I love the house analogy because, most people live in some sort of fixed shelter. And so we can really talk about, what it's like to keep up a house and what is in your body is the house for your soul, right? And so how do we keep that healthy and functioning properly?
I love that. I definitely like the analogy of the house because it is foundational to our torso, the pelvic floor,
Yeah.
that is. Yeah. Um, with people coming in and having possibly, in some cases, years of pain, going to the doctors and saying, oh, I have low back pain, I have coccyx pain, I have groin pain, right? These symptoms that they talk about don't necessarily peak on somebody's radar, say a doctor's radar, in terms of what it is that they're feeling. They might end up, going to PT for low back pain, and still not having any relief. And then it becomes this chronic issue. And for us, working as yoga therapists, we do have an understanding that some of these things can be related to one another.
Well, the symptoms, right?
Yeah,
I think the reason that it's a process of elimination is the symptoms that you present with could be many things down in that area because there's
right.
so much going on through that area. And so, like, what do you know? Like, even if I'm working with someone that's apparently healthy, and then all of a sudden, something's happening, something feels locked up, or they're having a pain syndrome that I can't help them reduce, or maybe we reduce it, but it's the reduction just isn't holding, then I'm like,
Hmm.
you got to go get it. I tell my clients, you got to go get a diagnosis. Like there's so much that runs
Right.
through there and I don't diagnose. I need a diagnosis to support you further. And so sometimes you're also, kind of going the other way where you're helping guiding them into the allopathic healthcare
Yeah,
system and seeking that treatment. And you're then supporting them on how to advocate for themselves.
exactly. And that was the piece that I was coming into, is that we do not tell people, oh, you have blah, 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 right? But we can start to see the patterns and then refer to whomever, they need to see so that they can find the support and the diagnoses so that we can further help them, um, which to me is a beautiful space for us to be in.
Yeah, I had a male client say that to me the other day. I overheard him talking to someone in the foyer at our center, and he was explaining, something that he was struggling with kind of that change of clients, and they were like, "How did you know?" And he was like, "Well, really, Kim keeps turning me on to these things." He's like, I think maybe I should go to the doctor, maybe I won't, and then she'll say, "Do you know I've heard that same complaint with you for X amount of time?" So like, what are we going to do about that? She kind of drills down into it, and she gives me the
Right.
courage to go have the conversation. And then
Yeah.
I also have done a little research, which helps my conversation with the doctors. And then they go from there. So yeah, I mean, we do see those patterns because we get to spend more time with patients than our
Yeah.
doctors do, right? The doctors used to get this amount of time and now they don't. So we can provide some of that context or texture, or maybe put, some questions together of like, hey, this is kind of what I'm seeing. This is the pattern. You take it
Hmm.
from there because I don't know what to do with that information. But, we know what
And
to do
we
with it in
also
the movement world.
Right? But we also get to help with the piece that was brought up earlier. Like if there is shame involved, oh, I don't want to talk about what's going on down there, or, I've been to the doctors and, they're saying that there's nothing wrong, or they keep sending me to PT, right?
Right.
Meaning physical therapy, because I have low back pain, right? For instance. These are all pieces that even through yoga therapy that we actually also get to support people in. It's like, well, let's, think about that thought process. Let's unpack it a little bit, you know.
It's lucky that we get to give people permission to slow down enough to hear what their body is saying. So you're right. We get to talk about feelings, emotions, traumas, but we always bring it back to the body and physical sensation. And what does that emotional aspect, that psycho-emotional aspect, how does that relate to the physical body? And we know that bridge, right? Pranayama is that bridge between the two. And so, that's where we get to start to tease this out and have an inward experience versus an outward experience.
Exactly. I love that because there's that self-reflective piece that comes in where you can come inside and start to become a little bit more aware of the thought process and why you might be having it and where did that thought process come from. So in the
Mm-hmm.
case of, I know for myself for many years, telling anybody that I thought there was anything going on down there, would
Right.
have brought
Yeah.
a lot of shame. Whereas now, I'm like, oh, the pelvic floor comes up, just rolls right off my tongue, the perineum. There's, so many ways that it has become so normalized in my own work and life that I don't even
Mm-hmm.
think twice about it. But there was definitely a point where shame came into play, and I had to realize, you know, this is something that's affecting my life, and the
Mm-hmm.
shame stems from, a belief system that is no longer valid in my life, and that was a really
Yeah.
interesting one for me.
Yeah. And I don't know if you've ever gone back and watched like old movies and you compare old movies to now, and old movies weren't so prudish in the 70s and 60s, right? You see more than what you would see today. And so oftentimes I ask myself, how did we become so conservative to not talk about down there, right? Because I mean, there's pleasure there, there's creation there, there's
Mhm.
so much stability, security, right? Is all in this area. And how did we end up in shame? And so I'll go back a little bit more. Like, when I was raped, Roe versus Wade was a fairly new thing, but it was there. But even
Mhm.
after I was raped, it was still my fault. Trying to get treatment afterwards, I was fired by 3 male doctors, and the last one said I should now lie about my health going forward. Um, you know, I now know that my disruptions for my mental cycles were trauma related, but they put me on birth control to try to regulate things. And I remember even just being out for breakfast one time. I remember they used to come in a cute little case and you just pop the pill out and take it. And they're super tiny, right? So here I
Right.
am eating breakfast. I take it. And I remember a male patron walked by me. I didn't even know them, saying, "You shouldn't do that. You don't do that in public." And like later as an adult, when I'm looking back, right, and I'm healing and I'm thinking about these little microaggressions, right, that had come up.
Yeah.
And I think to myself, how did he even know what that medicine was? He must have worked in the healthcare field, right, to know
Mhm.
of some sort, or medical adjacent to know what that was. But yeah, I really want to see things like this change for females. And I think maybe that has to start with men realizing that they have a pelvic floor. I don't know. But there is a book as we've been talking, I've been trying to think of her name as the author. So maybe in your show notes, you could put that for the listeners. But I like the book called The Vagina Bible. It's written by an
Okay.
MD, a female MD. And, she did so much research, and she even says, men, if you don't understand female anatomy, like read my book. For females, whose boyfriends, have maybe shared like you got an extra wash or whatever down there, and then that sends your whole flora off, and you're down a rabbit hole with different conditions that can happen, right? She addresses all
Yeah.
those things in the book as well as anatomy, and I really think that it's a great resource. It's a great educational tool for people to start with.
Okay, I'll make sure to put those in the show notes, the book in the show notes, so that way people can go ahead and do a little bit of diving into.
Yeah, just to understand yourself, and even if you're a male and you have a female in your life, like read it.
Mm-hmm. And I would encourage both men and women to definitely do some research on what the pelvic floor is and why it's important to both. We definitely need to have a certain amount of awareness just in our bodies, like just in our bodies, because without that awareness, there's, for lack of another word that I can think of right now, it's ignorance. When ignorance arises, so many things can sprout from that. And I'm, not going to get too deep into the weeds, ignorance and what that brings up. But the more we know about ourselves, more we know about one another, right? The more insightful, the more compassion, empathy we have.
I always say the
We
more we
grow.
educate ourselves, the more we
Yeah,
educate ourselves, the more peaceful we are. And that I
right.
think goes across any topic, right?
Hmm.
We could take broad topics and you can think about if we're educated, then we're more peaceful. Perhaps there's less war. If we're educated, we're more peaceful. Perhaps there's less self-judgment,
Yeah,
right? Negative talk
yeah,
towards ourselves, or projecting shame onto someone else. Um, so I think it all comes back to our responsibility to educate ourselves. And in that process, then we become aware of our ignorance, right? Because
right.
ignorance is bliss, right? When you just don't know, you know. But yeah, like women who are pregnant, even if I show them when they're getting pain, right, as the baby grows and it's
Yeah,
pushing the pelvis into an anterior tilt, and you start to get miserable in that late second to third trimester. If I get the pelvic in there, then of course they're judging themselves, right? But if I get the pelvic model out and I say, look at all that's in there,
yeah,
I tilt it up and I'll take the things out and I'll be like, look at the floor there. That's all holding this. And now the weight of the baby, and I always say the baby's like a watermelon in there, right? The
yeah,
weight of a watermelon, it's big like a watermelon. And then you're
yep,
going to birth that out. I mean, it's such a beautiful, miraculous thing. But we also have to realize that that's all that extra weight that you're holding. And the baby's in
right,
there stretching and kind of pushing on things. And so that does become uncomfortable. And
right.
as soon as I use education as a tool, you can just see like, whew, all this
Yeah,
stress drains from the mother. And I think that
right.
happens no matter what the condition is that they're coming to us with.
Hmm.
If we can have that educational component, if they're open and willing to learn, then that really is the trampoline to growth that kind of comes from that.
Absolutely. Absolutely. I had a funny incident that happened. I went to go see my chiropractor. I was brand new to this chiropractor, and he did a full, assessment, and he's over there, cracking this and thumping that, and he gets to my pubic bone and he pokes on it. I'm like, oh, that's tender. And he goes, oh yeah. He goes, you've had children. Like, yes, two of them. He's like, yeah, the pubic symphysis will, sometimes get a little turned up. And I was like, oh. And so he did a little snap with his, gun, and I was like, no pain. Like it instantly went away. And I
Yeah.
was like, I had no clue. And again, that was one of those, down under things. Just like,
Yeah.
nobody said this to me. Nobody ever told me that this might happen.
I have
Yeah,
one
so
client that has been with me since I made the career shift, right? And I'm coming up on 20 years here. And so this client has been with me their whole time. They found me as they were getting ready for their wedding. And so
Yeah.
I've taken her through a lot of her life, taught her how to walk in heels for her wedding dress. But anyways, she was laughing because when I first started with her, one of my mentors was like, if you touch the pubic symphysis and the sits bones, right, sometimes people need that felt sense. If you can do that. And I thought, well, I was taught stay out of the red zones. I'm not doing that. That sets me up for a liability. So of course I wanted her to understand her pelvic floor, right? So I'm trying to test
Right.
my knowledge out on her and myself. And I was like, will you touch yourself and like do this? And some women are
Right.
afraid to touch themselves, even over their
Yeah.
leggings. And, you could teach that pelvic clock, right? Whether you're in the anterior and so I'm like, just feel the pubic symphysis. Which way are your fingers going, right? And look at that. And she was just laughing at me because in the last month I was like, it's okay if I touch you there. I'm just going to touch. And she's like, oh, yeah. And she goes, oh, remember when you said you were never going to do that? And aren't you becoming what you're one of your very first mentors where you're just like, right here? But I use a lot of washcloths to fold it up and having people sit on them so that they can have like a proprioceptive awareness. Because I
Right.
think people do kind of like the back, right? We stuff so much back there out of sight. The same thing happens here. And so if you can start to use balls or square
Mhm.
claws or little bean bags to help people get a felt sense there, a sensation,
Yeah.
it's a safe place for them to be. And please, if you're a practitioner, please ask permission and, don't go there unless you have to. Let the patient kind of find their own space and time. But, I just share that because, it's just so funny to think 20 years ago, I would never think of uh, getting into the pelvic floor. Like now I just get right in there and chat about it.
Yeah. Well, I think it's also very empowering when somebody could find their own pelvic floor. You know,
Yeah,
it's
and that like that narrowing of the like kind of feel that felt sense of pulling the sits bones close together and
yeah,
pulling up on the perineum and bringing it up without like it's not like clamping down on your butt cheeks, right? It's this
right.
inner sliding and scooping and hollowing out. And once you find it, you're like, oh, it feels so good, right?
Yeah.
Changes your posture, changes your energetic style self.
Mhm.
Um, but it
There's
takes a while to get there.
yeah, there's a woman, I can't remember her name, but I did purchase one of her little programs. And I say little because it's one of the shorter ones. I think it's like the introduction, to her program, and it's called the Buff Muff. And one of the
Love
things
my,
that yeah, Buff Muff, yeah, she talks about is like if you were picking up, I believe it's a blueberry between your
mm-hmm.
anus, and the pelvic floor. So I was like, oh, that's amazing. Like it just that imagery alone, even though I was already aware of my pelvic floor, that imagery alone was super helpful.
Well,
Shelly
when I was
Bosco
going through my
also.
Pilates training, that really is how I unlocked my pelvic floor mysteries was through my classical Pilates training. And
Mm.
they had me wear a jade egg. So I would
Oh,
take a jade egg and insert that into my vaginal canal. And as soon as I could walk around and hold that, then I started practicing my Pilates without the egg being pushed out. Because that's what happens a lot of times is people bear down on the pelvic floor,
right.
right? When it needs to be engaging versus pushing. And so if you're pushing, right, the jade egg is going to come right out.
Pop out. Yeah.
And if you're holding your pelvic floor in and out, then you can hold that while you're there. I will say, the jade egg is easy to keep sanitary and to use and stuff, but sometimes it's a little hard to get back out. So I usually suggest now Ben Wallace balls because there's usually a string, right? And so then they can put a Ben Wallace ball in there with a string like a tampon, and you'll be able
And then pull it
to
out.
work the pelvic floor. Yeah, yeah. So
Yeah.
sometimes I use that as well with women.
So if somebody was still feeling uncomfortable talking to, say, you or me or their doctor, um, what are some of the things that you might, let them know in terms of why it would be good to share their, say, incontinence or their pain with somebody so they can receive some support?
Well, incontinence, I find a lot of times women don't know that bladders are actually trainable. So for women, you think about when you're little, right, and you're learning to potty train and that kind of thing. It's kind of easier for a parent to pull over to the side, open the door, and have a little boy stand and pee. It's much
Hmm.
more difficult for a little girl because you have to disrobe, right, and you're standing
Right.
there squatting, right, and you're half naked. So right at that point, parents start saying, "Do you have to go to the bathroom? Go to the bathroom." Right. And so we start forcing girls to go to the bathroom not on their schedule, right? Because we want convenience. So right
Right.
away, that bladder for women is being trained to not perhaps hold as much. And so then, you kind of do the pee pee dance where you tense everything up and you crush your leg and you're like, oh, I gotta get her.
Yeah.
Right? That starts to happen. And really during that moment, instead of tensing, if you can relax, you're more apt to not have an accident.
Right.
So, it's first understanding not to shut down your bodily functions, right? And then if you can relax around that. And then from there, then you start to tease apart the flexibility and strength exercises. I always approach people with tenderness. If I have a sneaking suspicion something's going on there, but
Hmm.
they're afraid to chat about it, I just say, hey, I just want to let you know that I'm open to have the conversation if you are. You don't need to say anything to me right now. I just want to plant the seed that that's a possibility. If you ever want to talk about symptoms there,
Right.
or felt sense. And usually, after you start to develop that healing presence or that trust, then these things slowly start to come out. I just had a client that I've taken her through so many pregnancies, and it's my first time to see her not pregnant. And she said, well, you've never seen me not pregnant. We've always been pregnant together. And I started laughing and I was like, oh. And so then she was finally able to start to talk about some pelvic floor stuff. But it took 3 children.
Yeah. That's awesome. That's awesome. When you have worked with men, do you find that they have the same kind of, I don't want to, I guess, well, shame about talking about what's going on? And how do you address that? Is it a similar?
Shame in a different way. So,
Hmm.
if they've had prostate cancer or there's some erectile dysfunction, then there's shame
Hmm.
there. Other than that, I don't really notice any shame other than like, oh, or like just surprised to learn about themselves, right?
Yeah.
Um, so, it's two different places where women, it tends to just be shame all the way across the continuum.
Yeah. And I do want to point out that I think this is a good piece to kind of point out in terms of the differences between possibly, treating a woman versus a man, is that that shame may show up differently. And
Mm-hmm.
specifically because I think with women, it becomes more internalized than it does with men because men are allowed to be more sexual. They're allowed to talk about, you know, things down under, where with
Yeah.
women, it's not that. And it comes from a very early age. And it's not just within a home, it's not just within the religion, it
Mm-hmm.
is as a societal whole, something
Well,
that we don't necessarily talk about.
even think about the language that we hear about not being able to have curves. Pull the belly in, make your
Yeah.
butt smaller, tuck, right? And so all of that just like makes for this big rat race of like, what is that in there? And so you have
Yeah.
to like stop all that. It's okay to have a little hip swing, right? Your hips
Yeah.
should be mobile, right? It should be fluid. And you're right, guys
Right.
don't get shut down that way like women get
Mhm.
shut down in just having pelvic floor mobility or pelvic
Right.
mobility.
And I've actually wondered, I don't know if there's any studies or if you found this, but I've actually had that conversation with women before too, because I'll see a lot of women kind of holding themselves very tightly, especially through the hips. And also, women are meant to have a little bit of a side to side sway in their hips, and your arms are supposed to move. Let's
Yeah, like a
practice
pendulum,
walking.
right?
Right,
Yes.
exactly. So let's
Yeah.
practice walking. And they'll come back and they'll be like, oh my gosh, I feel so good. That feels wonderful. I didn't know. And it's like, yeah, because we've been told, if you sway your hips too much, then you're being sexual. It's like, well, no, it's a natural part of, moving your body. But I think that's a piece that lends itself to women becoming hypertonic, through their
Mhm.
pelvic floor because they're just pulling everything inside and, not allowing themselves to have that fluidity, that flexibility, within their pelvis. You have any thoughts on that?
I 100% agree with you. I concur. Yeah, no, it's all very true. Um,
Yeah. And I think these
and
are
I
all wonderful things that, once that goes back to that idea of ignorance, the more we talk about things and, use the word educate, right? So we educate, we talk, we open ourselves up to all of these pieces that we're not sure about or that we might have questions about and don't want to really talk about them, say due to shame or, you don't say if you're, a gentleman and you don't want to go to, see the pelvic floor specialist because it's full of women, right?
Mhm.
It's probably the
Right.
most nurturing place you can walk into, but it's that idea of, just literally allowing ourselves to just be more open to these conversations in and out of a therapeutic, setting
Mhm.
and learning to kind of trust that if you do have pain and it's not being resolved, to definitely keep talking and reach out to people, especially somebody like you who has, an educational background. And it'd be like knocking at your door going, hey, you know, what's going on? Because you may
Mhm.
not diagnose them, but you can definitely be able to say, these are some of the things that you might want to talk to your doctor about. I'm seeing this common theme that you're bringing to me. What if we
Yeah.
bring it to your doctor in this setting? see what comes back.
Right. Yeah. Because you can give them an educational pamphlet or an educational resource and say, does this resonate with you? And if any of these symptoms do resonate with you, I'd like you to schedule an appointment with your doctor and go back. You know, we had mentioned earlier in this segment about, um, you know, how wonderful it is that we get to spend more time with clients, right, than the
Yeah.
doctor. And so sometimes we can put together those more complex patterns or crossovers for diseases such as chronic pelvic pain, that is a disease of elimination. But then, to ask them to think about these symptoms and to have that conversation with the doctor to go back. I mean, isn't that a wonderful two-way street,
Yes.
right? The doctor has a diagnosis, they saw them, they have some symptoms. The doctor's like, maybe you need therapeutic movement, maybe go see a yoga therapist, right? The yoga therapist is spending more time with them because we're not under the insurance umbrella at the moment. And so, then we notice some crossover patterns. We help the client with their language, right? And then they go back to the doctor. So we refer back, right? And
Right.
then they get their diagnosis and then they refer back, right? And it's this wonderful way to keep someone centered in their self care because we know that they need at least 2 to 3 different modalities, different people helping them. And everybody's 2 to 3 is different. And why is it different? Well, we're all our own little unique ecosystem. We all have a different lens of life, right? And different things, pathology that's happened to the body. That's why yoga isn't prescriptive like a protocol. One protocol
Right.
fits all, right? And so we're able to tease and to have that creativity to make things unique for that person. But it is this synergetic energy. And, one thing that I've been kind of up on my soapbox now for a decade now or more is stop fighting over modalities. One
Yeah.
modality isn't better than another modality. Now, I do say stay out of the trends. Trends, don't do trends, and be cautious of things that are AI generated that wasn't meant for the human body to do. Go to someone that's educated, that has evidence, that understands how to read research, understands how to apply the research, that has a vast knowledge right? We're not a brand, we're not a trend, but we are evidence informed therapeutic movement. We include soul care or spirituality, and they do work synergistically together. And, no one person is a one stop shop for anybody.
Right. I love that. I especially love the fact that, you're bringing in that piece of not just being able to read the research, but apply the research, which I think is huge, especially in the time that we're living in with AI and multiple modalities, not knowing who to go to or where to go. But this goes, to really learning to also trust yourself, that as you go and interview the different people, that you're looking at to help you, you know, not everybody is going to be a good fit. So being able to interview who you think might be able to help you and figuring out if it's a good fit and seeing if they have the knowledge, as you pointed out, right, to be able to apply that, with your particular whatever it is you're bringing into, your therapy session or your therapeutic session or your doctor. Not everybody believes that they have the ability to go in and say to somebody, I don't think you're the right fit for me. And so I really want to push out there to everybody, that might be hearing this, that whether it's your pelvic floor or, as we talked about, and thank you so much for opening up during your first session or your first interview with me about cancer, right?
Mm-hmm.
When we are moving into these different pieces of healing, whether it's from trauma or, physical, neurological, it's important for us to be able to find the right person to work with, somebody that we feel that we can trust, that we can open up to. And, as you said, educate, right? We'll have them educate us, send us, refer us in the right direction. I guess the point that I'm trying to get to is that we all have the ability to say, no, I need to go to somebody else, so that's just my little soapbox, please. You're,
Yeah,
no
like
matter what it is.
when I meet clients, like I new clients, I always say, I'm not the right person for everyone. I
Yeah.
don't do superficial well. I kind of just want
Oh,
to
I love
get down
that.
in there. And but sometimes that's that's not sometimes
Yeah.
you're not at that stage and ready for it, right? There are stages of change. And I think that's probably where this is where kind of our conversation is at the point is understand the stage of change that you're in.
Yeah.
And someone who's a healthcare practitioner can help guide you through that stage of change. So I always tell people, like, it's not me. I don't have the answer. You have the answer.
Right.
And I'm just being your accountability partner. I'm being your guide. I'm mirroring back to you, the right, like, yeah, it seems like it's
Yeah.
resonating with you, right? And we're just trying to build people up
Yeah.
to whatever whatever that means for that person, because I can never feel what they're feeling. So as much as they're willing to share in their felt sense, then I take and I ponder that with everything I've learned and things that I'll research for them. And it's really my clients over the years that have set me on these educational journeys,
Yeah.
trying to support them and help them. My husband, this past week, I have a new case that's kind of complex, and he was like, "Oh, are those your books? Or you're working on, XYZ case?" And I'm like, "Yeah, I am." And I was mentoring some younger yoga therapists. They're coming up, and they're like, "Miss Kim, you have quite a few books." And I said, "Yeah, think about it. When I started 20 years
Yeah.
ago, like, that's all I had."
Yeah.
Now you have like apps and, research and, all these things. So, now I have that
Right.
stuff too, but, we didn't have, and it's not like our yoga books that in the beginning that you could even go check those out from the library, right? They
Right.
were kind of obscure and smaller publishers. And so you really had to search for this information. But to me, that's the part that's so exciting, right? Is this journey, is this creativity, is this, seeking. It's just a wonderful and job, and I feel so privileged for people to let me into their life in such an intimate
Yeah.
way.
Agreed. Absolutely agree with that. Kim, it has been such a pleasure to be able to have you come back on and have part two. Talk about everything pelvic floor. Is there anything that you would like to close with before we end?
No, I just
Any
want to say thank
last
you
little
so
nugget?
much for your thank you so much for being interested in my work. And I really enjoy talking to other yoga therapists and just inspiring people. I know it's changed my life so much, and it's very hard to articulate. I think it's something that you really do have to experience. So thank you for the work that you're doing.
Thank you. Maybe we'll have a part three.
Maybe.
Thank you.
All right, you're welcome. My light me honors the light in you. Namaste.
Namaste.
Thank you for joining us today. If you would like to support this content, hit the like button, subscribe, or leave a comment. Thank you so much for joining us. Have a fabulous day.